What is silent asthma and how does it happen? Imagine feeling like you can't catch your breath but not hearing any wheezing or coughing. That's what silent asthma is like, and it can be quite confusing. Many people think asthma always comes with loud wheezing or a persistent cough, but silent asthma doesn't. Instead, it sneaks up with subtle signs that are easy to overlook. Silent asthma happens when the airways in your lungs become inflamed and narrow, but without making the usual sounds. This means you might experience shortness of breath, a feeling of tightness in your chest, or even fatigue. You could also notice rapid or shallow breathing, trouble speaking, or feeling anxious or restless. Some people might yawn or sigh more often without realizing it. Because these signs are so mild or common, they can be mistaken for tiredness, anxiety, or being out of shape. The tricky part is that with silent asthma, the usual loud wheezing or coughing is missing. Sometimes during a severe attack, called a silent chest, airflow becomes so limited that no sounds are heard at all. This can happen during a serious asthma attack when the airways are extremely inflamed and constricted. The triggers are the same as regular asthma, things like pet dander, pollen, mold, tobacco smoke, chemicals in the air, or exercise. The danger with silent asthma is how easy it is to miss. Because the symptoms are less obvious, people might not seek help quickly. If breathing becomes very difficult, you might notice skin pulling in between your ribs or at the base of your neck, lips or nails turning bluish, or you might struggle to speak. Dizziness or feeling faint can also be signs of a medical emergency. Diagnosing silent asthma involves lung function tests, not just listening for wheezing. Doctors use spirometry to measure how well your lungs are working, along with peak expiratory flow tests to see how fast you can blow air out. Sometimes, tests for airway inflammation are done too. Managing silent asthma means recognizing these less obvious signs early and sticking to prescribed medications that reduce airway inflammation. Understanding silent asthma is important because even without loud sounds, the inflammation and narrowing in your airways can be just as harmful. Being aware of these subtle symptoms and triggers can help you get treatment sooner and avoid serious complications.